Welcome to Connections Child and Family Center. We're really glad you're here. And whether you're exploring therapy for yourself, your child, your family, we know this step can come with a lot of questions, especially around how therapy works and how insurance fits into the picture. So, I want to do a little overview for you so you can feel informed, supported, and confident as you decide what is right for you and your family. So at Connections, we are a team of licensed therapists and psychologists with specialized and advanced training. Our clinicians have pursued special additional expertise in areas like trauma, DBT, child and family therapy, maternal mental health, ADHD, and other evidence based approaches. That means we're not just offering you general support, we're bringing you targeted skills that are meant to meet your specific needs. We believe therapy works best when it's compassionate, collaborative, and tailored to the individual or family sitting in the room. So we offer in person and telehealth options so you can fit care into your real life, not add more stress to it. We also know that access really matters. Our administrative team is here to make getting started as smooth as possible. From scheduling to paperwork to insurance questions, you'll have real people helping you every step of the way. We offer flexible scheduling and guidance with insurance so you're not left trying to figure out everything on your own. Before we go any further, though, let's talk about some basic insurance terms because a lot of people were never taught how this really works. A deductible is the amount that you will pay out of your own pocket every year before your insurance company starts contributing to your care. A copay would be a fixed amount that you would pay per visit, and sometimes that varies depending on if you see a generalist or a specialist. A coinsurance would be a percentage of the cost you pay after your deductible is met for the year. These terms matter because they directly affect what therapy is going to cost for you, not just here, but really across the healthcare spectrum. And so I want to come to an important point. This is where things often become clearer. Your deductible applies to all of your medical care, not just therapy. Doctor's visits, labs, urgent care specialists, usually everything counts towards the same total. So here's an example that I wanted to share with you. In this example, someone with a $3,000 deductible for that year may have already paid for other medical care earlier in the year before they pursued therapy. So when therapy starts, those sessions continue filling that same deductible. And until that deductible of $3,000 is met, you as the client would pay the contracted rate that we have with your insurance company, even when our provider is in network. Basically, you're getting a reduced rate that your insurance company negotiated with us on your behalf. Once the deductible is met in completion, then your insurance company usually starts helping pay for your care, and you would pay the rest through a copay or coinsurance. That's the moment people usually say, "Oh, now my insurance is helping." Here's how we help to make this as transparent as possible. When you become a client, we verify your benefits, explain what we see in your coverage, provide you as the expected or estimated costs that we know based on the information your insurance company tells us about your plan, and we handle any in network billing directly. If you come to us to use your out of network benefits, we provide you a super bill so you can easily seek reimbursement through your own insurance portal. While we don't control the insurance design, we do believe in clear communication and no surprises. We also encourage clients to be active partners in understanding their own coverage. You, as the consumer, can check your insurance portal at any time to understand your coverage. You can call the member services number on your card and ask specific questions about your mental health benefits. Sometimes, as a consumer, you get that information more easily and quickly than we do as a provider. Because deductibles apply across all of your care, your insurance company is the best source to know how much you've already met and what your plan covers for the year. We know that mental health care can feel really expensive. So, I want to tell you a little bit about some things that are impacting the cost of care. We're going to call this the double squeeze. It's important and often eye opening. We know families are facing higher deductibles and more out of pocket costs for their insurance plans than ever before. Many people are paying thousands of dollars before their insurance plan contributes meaningfully to their care. At the same time, on the other side, therapists and practices are also experiencing rising costs, rent, staffing, technology, training, while insurance reimbursement rates for our providers have largely stayed the same for decades. Insurance companies sit right in the middle, where they're creating pressure on both sides, the double squeeze. That means that families are paying more and providers are earning less in real dollar value terms. But neither side is truly in control of the system. This isn't about overcharging anyone, it's about how the healthcare system in America is structured. We believe that deeply that quality therapy matters. That means therapists with specialized training, manageable caseloads, and time to think, prepare, and show up fully for each client. It means ongoing education so that care stays current, ethical, and effective. It means sustainable practices that allow therapists to do their very best work, which directly benefits you and your family. Our commitment is simple. We offer compassionate care, clear communication, transparent costs, and real help navigating a complicated system. You're never expected to figure this out alone. If you have questions, you need help to understand your benefits, or you're ready to get started, we're here. Thank you so much for taking the time to learn more about how therapy and insurance work